Hello fellow nurses, today we're going to have a discussion about historical perspective and nursing foundation. A look at nursing's beginning reveals its continuing struggle for autonomy and professionalization. Recurring themes of women's roles and status, religious values, war, societal attitudes, and visionary nursing leadership have influenced nursing practice in the past. Many of these factors still exert their influence today, especially religion. Although many of the world's religions encourage benevolence, it was the Christian value of love thy neighbor as thyself and Christ's parable of the Good Samaritan that had a significant impact on the development of Western nursing. You can see here during the 3rd and 4th century, Fabiola converted to Christianity and used their wealth to provide houses. The Knights of St. Lazarus also dedicated themselves to the care of people with leprosy, syphilis, and chronic skin conditions. Even Florence Nightingale during that time already had her training at the Kaiserwerth School. Let's know more about some of our nursing leaders in the past. Florence Nightingale is said to be the lady with the lamp. That is because of her achievements in improving the standards for the care of war casualties in the Crimea. She was also the first nurse to exert political pressure on the government. And at the same time, Florence also was recognized as the nursing's first scientist tourist for her work, Notes on Nursing, What It Is and What It Is Not. She was believed in personalized and holistic client care. Her vision also included public health and health promotion roles for the nurses. Apart from Florence, we have also Clara Barton from 1821 to 1912. She's a school teacher who volunteered as a nurse during the American Civil War. Clara, noted also for her establishment of the American Red Cross, which linked with the International Red Cross when the US Congress ratified the Treaty of Geneva or the Geneva Convention. Clara also persuaded the Congress in 1882 to ratify this treaty so that the Red Cross could perform humanitarian efforts in time of peace. Another nurse leader is Linda Richards. Linda is known for introducing nurses' notes and doctor's orders and initiated the practice of nurses wearing uniforms. She also was credited for her pioneering work in psychiatric and industrial nursing. Mary Breckinridge, on the other hand, she established the Frontier Nursing Service or the FNS and worked with the American Committee for devastated France, distributing food, clothing, and supplies to rural villages and taking care of the sick children. Mary also started one of the first midwifery training schools in the United States. Lavinia Duck is said to be a feminist, prolific writer, political activist, and a friend of Mary Wald. She's also campaigned for legislation to allow nurses rather than physicians to control their profession. A notable person is Margaret Higgins Sanger. She was imprisoned for opening the first birth control information clinic in America, and she's considered to be the founder of Planned Parenthood. And lastly, Luther Christman is the first man to be a dean at the University School of Nursing, and she was nominated for president at the American Nurses Association, and at the same time elected at the American Academy of Nursing, which is said to be the living legend. So what then now is the definition of nursing? Initially, Florence Nightingale defined nursing as the act of utilizing the environment of the patient to assist him in his recovery. Additionally, Virginia Henderson, one of the nursing tourists, also defined nursing as the unique function of the nurse is to assist the individual sick or well in the performance of those activities, contributing to health or its recovery or to a peaceful death, that he would perform unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. The most current definition of nursing is from the ANA. This is in 2003 and it reads as, nursing is the protection, promotion, and optimization of health and abilities prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and population. So what then now are the 4 areas of nursing practice? The 4 areas of nursing practice are promoting health and wellness, preventing illness, restoring health, and care for the dying. The nurse holds different roles and functions, such as a caregiver. The nurse role has traditionally included those activities that assist the clients physically and psychologically while preserving the client's dignity. The nurse is said to be a communicator. The nurse must be able to communicate clearly and accurately in order for a client's healthcare needs to be met. A teacher. The nurse helps clients learn about their health and the healthcare procedures they need to perform to restore or maintain their health. A client advocate. The nurse may represent the client's needs and wishes to other health professionals, such as relaying the client's request for information to the healthcare provider. A counselor. Nurse counsels primarily health individuals with normal adjustment difficulties and focuses on helping the person develop new attitudes, feelings, and behaviors by encouraging the client to look at alternative behaviors, recognize the choices, and develop a sense of control. A change agent. Nurses also often act to make change in the system. It might be as a clinical care if it is not helping a client return to health. A leader. Effective leadership is a learned process requiring understanding of the needs and goals that motivate people, the knowledge to apply the leadership skills, and the interpersonal skills to influence others. A manager. Nurse manages the nursing care of individuals, families, and communities. Case manager. Nurse case managers work with a multidisciplinary healthcare team to measure the effectiveness of the case management plan and to monitor outcomes. Research consumer. Nurses need to have some awareness of the processes and languages of research, be sensitive to issues related to protecting the rights of human subjects, participate in the identification of significant researchable problems, and also be a discriminating consumer of research findings. And lastly, expanded career role of the nurse will be a nurse practitioner, clinical nurse specialist, nurse midwife, nurse educator, nurse researcher, and nurse anesthetist, all of which allow greater independence and autonomy. I believe this is all about our discussion for today. Thank you and see you on our next session.